The Healthcare Technology Research Group are a group of healthcare researchers who are drawn from the professional disciplines of allied health professions, nurses, midwives, clinical and social scientists, and collectively we're using our knowledge and skills to really solve technological problems to healthcare issues. Co-creating the future using multifunctional robots in occupational therapy and dementia is a 2-year study funded by the Royal College of Occupational Therapists in the United Kingdom. The key issues that we're really looking at are how can we deliver robotics in our future care provision.
One of the things that I think is absolutely unique about this research is the co-production in terms of the collaboration between a range of different partners that are coming together. That includes academics in occupational therapy at Edinburgh Napier University. It includes academics with expertise in robotics and robotic technology at the National Roboterium at Heriot-Watt University. We're supported by one of the leading charities in Scotland, Alzheimer's Scotland, including people with lived experience themselves through the Scottish Dementia Working Group and also the National Dementia Carers Action Network. And one of the things that we're trying to do is to bring everybody together to develop a comprehensive overview and understanding of the different components that will allow us to think about how we might be able to harness quite complex technology to support people living with dementia to live a positive life for longer.
I was diagnosed with early onset dementia, Alzheimer's subtype, in January 2022 at the age of 58. For me, I think it's exceptionally important that people with dementia get involved in projects such as this because we can provide valuable insights and perspectives.
We have lots of care guidelines that therapists follow to make sure that people get access to the specific type of rehabilitation that they need. And I suppose the ultimate aim is that these robotics will support that.
The purpose and the use of robotics to support rehabilitation and dementia is still a really new field and developing field, and to research it will be really an amazing opportunity.
There's so much potential for there, whether it be for social connectivity, whether it be for the calmness, for just checking up and talking to people, giving them that reassurance. And they can lead in so many aspects within a care home setting, within a home environment. They could actually assist with daily tasks. Ultimately, I think that's where I would love to see it going.
I would hope it has a wider implications and potential to share that work and to embed the work within the wider dementia remit within Scotland, and look to see how we could embed it with the Scottish Dementia Research Consortium and other national networks that are leading and developing research in dementia, both in Scotland and in the UK.
We know that robotics and artificial intelligence are a priority for the Scottish Government, and we know that they understand the need for this technology to be able to respond to the health and care needs of the Scottish population. For us, it's really exciting to see occupational therapists be at the forefront of that, to be contributing to the evidence base and to ensure that what is being researched is applicable in everyday life.
We hope that we will be able to help support our professional colleagues who are under a lot of pressure to deliver services with constrained budgets. And so we hope that being able to find technological solutions will help transform the service provision they can make.
Innovation, I think, means to me always holding an open mind. And by holding an open mind, what I really hope is that we can begin to reimagine the future practice when working as an occupational therapist with people living with dementia, so that ultimately we can really improve, enhance rehabilitation outcomes for people living with dementia, their families and caregivers.